Many times in research, we type and cross certain other kind of design. I like to refer to the epidemiology designs that we sometimes use with qualitative or with quantitative. One of those are the cross-sectional design, longitudinal, perspective, okay? And those are the design that we often must be able to mix and match, if you may. Longitudinal means it's go over a long period of times. Cross-sectional, it's done right there. And, done cohort, case studies, all of those are in the epidemiology research design, but we utilize them often with quantitative and qualitative studies. A good research design will always have a good statistical conclusion, will have internal validity, and will have a good construct validity. Those things make a good design. The definition for concept is using one variable. Construct, you're using two or more variable. Okay. In both qualitative and quantitative design, we have to always collect data. And so different research are able to do different things based on the design. So the design will lead you into coming out with the best quality of research. Alrighty? For qualitative research, we stop collecting data when we see their saturation. That just means that we are hearing the same things over and over again. In quantitative, there's a key part of when you stop. And in quantitative, you stop just before you start to collect the data. So just before data collection. I actually said that wrong. So in quantitative, you stop just after the data is collected, okay? In quantitative research, there are there's a few different types. I don't want to put it like that because when you go on for your master's and your doctorate, you're going to learn expansion of what you're being taught today. But the most frequently used point types are the ethnographic for qualitative, phenomenology for qualitative, grounded theory is qualitative, case study, narrative are all qualitative. Descriptive can also be used in qualitative. All right? Get it? Many of the data that is collected in qualitative research is done by either focus group, interview, or questionnaire. And so the questionnaire happen to be the most informative. However, the bias that comes with those type of data is that they bring bias to the table. So people will lie, like I said before. So therefore, you want to make sure that you ask one question in several different ways. And if they answered all of those questions, the same response, it's probably true. But if they change the answers, something is definitely wrong. Okay. So we have in research, you must know the level of measurement. We just talked about that. So we talked about the nominal, ordinal, interval, and ratio. Know all of those definitions. Nominal is the least important one because it derives from pretty much a category. I can categorize anything, right? And so as a result, I told you about my favorite basketball player, Michael Jordan. His number was a categorical number. They gave him the number 23, which stuck with him until now. I see now there are other basketball player that has 23, but his was retired. So once you're retired, your number can pass on. So nominal, which is a categorical type of data. Ordinal is the order that something comes in. So you can say from bottom up to bottom down. Okay? Hold on.